I'm one of the veterinary assistants here at Kelsey Canine. So welcome. Today we're going to talk about lumps, bumps, and growths. Oh my! To continue with our Pet Cancer Awareness Month. So yay. So there's three main types that we see the most of, and that's lipomas, spacious cysts, and mast cells. So we're going to go over those, and then we're also going to go over when you should come in. So lipomas are fatty tumors. There's nothing to worry about. The only time you would need to remove them, they're more cosmetic. So the only time you need to remove them if it inhibits movement. Like say it's growing right here and it's to where they can't hardly move their arm, or if they do, it's not doing right, then you would want to remove it. But don't let them get too big, because then that would mean if we remove them, we'll need more skin to close it, and that can cause an issue there. The second one is Spacious Cysts. They're my favorite because they're kind of like pimples without heads, but don't pop them yourselves because they also come with a sac in them. And so your veterinarian needs to make sure they got everything out, including the sac. It's just oil glands get clogged, and then some really fun stuff forms inside. The last one is mast cells. That's the one you do not want. It's cancerous. And usually we want those to come off immediately. When you bring them in, if it's been there more than 3 weeks, if the dog's bothering it, and if it's gotten significantly larger or bigger. But as always, if you're concerned, we're concerned, because we really do care and love all our patients. So just come on in if you're worried about a bump. The only one true way to know is if we do what's called a Aspirate, which is when we get a needle, we poke it a couple times, get some good stuff out, and put it on a microscope, or put it under the microscope to see what it's made out of. Usually the doctors can tell right away if it's made of fat in it, or if it's got, you know, it's a cyst, but just always go to your veterinarian just in case. All right, so the way we examine lumps, bumps, and growths, oh my, is that the doctor will look at it, palpate it, which means feel around, move it around, and sometimes they can tell what it is from that alone. But usually we'll have to do what's called a needle aspirate. And so what that is we get a needle and we basically just make a little poke and see if we can get anything out of it. A water balloon to represent the growth. And then you'll need a needle, syringe, and a slide. So what they do, and it's not painful to the pets, we are very for no pain, or at least count down on pain as much as possible. So what they do is they uncap, and there's multiple ways to do a needle aspirate, but this is the one that I've seen the most. But you get the needle, stabilize it, and you just poke around like so. And then you put the needle on after you pull back on it. And then inject on the slide. They usually stain it and then look at it under the microscope. And that can tell you what cells make up, or if it's just fat, and just to see everything that's there. All right. Well, thank you for joining us here at Kelsey Canine over lumps, bumps, and growths. Oh my. Next week we'll be talking about treatments or different things we can do to treat these lumps, bumps, and growths. So see y'all back next week.